What would you say to somebody who's starting out and hoping to move into health economic outcomes research or even market access? Like, what advice would you give somebody?
Yeah, so I think it depends where you're starting. So if you're coming from an agency background, I definitely look to try and get on more of those value comms projects. So I think there's more and more. So a lot of the publications for health economics works goes to a medical writing company, and sometimes people shy away from that. I remember at our place they'd be like, "Oh, it's a scary health economics paper," but I think that's the way I got into it. So definitely try and do that value comms. Then I think if you're wanting to move into HEOR and pharma, you would probably need to go to a specialist market access consultancy or a health economics consultancy. And there's some brilliant consultancies, either part of those bigger agency groups or smaller, more bespoke ones. You get some great experience working with like lots of different therapy areas. You do lots of submissions. I think you probably get more experience there than in pharma when you sometimes work on just one product. Um, so, and those consultancies, they're kind of seen as more expert consultancies. I know their rates are higher, that you can definitely charge out more as a health
Yeah.
economic writer for sure. So if you're interested in that, I definitely look into moving into that. So I think that's the way in from agency. And then pharma, I think it's just looking out for secondments, even if it's not something that your pharma company does, just ask. I know where one of my colleagues asked, she was in market access, same as me, and she asked to do a secondment in HUR and they made it happen.
This is a great point because I'm not sure that there are so many secondments in my company, but what I have been thinking about is actually asking if I could work on one small project, and getting permission from my manager. Because I'm sure that's possible if it was 10 or 20% of your time, you can negotiate. And if it's going to benefit your department in some way, then I think there's so many possibilities.
Yeah, I'm sure the HUR team would love that.
How do you collaborate cross-functionally? And how do you ensure there's alignment between functions? Because for the listeners who are kind of not in pharma itself, it can be a little bit of this kind of black box. And because when you're not in it, you don't realize that all the functions kind of work in their swim lanes and
Yeah,
there's very little
definitely.
connectivity between them. So yeah, I'd love to hear your take on sort of how you manage that on a daily basis.
No, that's a great question. And it's one of the things moving into pharma I found um, quite difficult to navigate, and even more so moving from the UK team where we're a really close team and collaboration was easy, moving into a global team where, yeah, you have these different functions with different budgets, different strategies. And HUR, it's a very collaborative function. We're a very small function and we're kind of the bridge between medical and access. So it depends on the company. You can be in either access or medical. So that's why you have to be even more collaborative with HUR, because in other companies, things like burden of illness reviews or budget impact analysis, they have traditionally been done by other functions. So HUR can be quite a new function. So if there's a lack of understanding of your role and who owns that kind of research, it can be difficult. So, and sometimes people worry about treading on toes and budgets, where does the budget sit? So I think it's that lack of understanding sometimes. So as I said, HUR you have to be even more collaborative. So you have to work extra hard with that communication. So at the start of a project, at a making sure you have those kick-off meetings, and I think just informal touch base with people just to kind of explain your role and set out expectations at the beginning. I think face-to-face meetings, not all the time, but I think especially when you're either moving into a new product or a new brand and they haven't worked with HUR, I think it's good to explain your role. And if you can have a face-to-face meeting, I think that sometimes helps as well.
Yeah, I completely agree. And sometimes it's just those little like coffee break informal getting
Yeah,
people, isn't it? You know, building that relationship is so important. And I totally agree with you. Just having like an initial kickoff with the cross-functional team or individually, like this is what I do, these are my responsibilities, I'm accountable for this, you're responsible for this, you know, I need you to kind of input, you know, all of these kinds of things. It's really good to that so that it's clear what everyone's role is within this cross-functional team, because otherwise things never get done, do they? Because everyone thinks that someone else is
Exactly.
doing it.
Yeah.
Yeah.
One thing that's really important, even though we do, economic analyses, we still need things like clinician input to make sure that things we're doing are relevant, clinically relevant. And we often put things like, estimates for how much a procedure costs. So we often need to talk to clinicians to make sure what we're doing is correct. So actually talking to a clinician, you don't want to be treading on toes in the medical team. So you want to make sure you bring them in, you want to make sure that they know what you're doing. Sometimes they're quite happy for me to go out to a clinician myself. Sometimes they want to do it on my behalf. But as long as, you just have to try that extra hard, making sure and that you're following, all compliance procedures as well, of course.